90% of my phone calls go like this. Does my mom need home care, or should she go to a nursing home? In this video, I'm going to break down the pros and cons of home care versus a nursing home and help you decide what the right fit is for you. My name is Mitch. I'm a physical therapist and patient care coordinator with Premier Companion Care Services. Check out the other videos on our channel to get informed about home care and how it can work for you. What is home care? Home care is essentially care that allows your loved one to stay at home. This involves finding and hiring a professional agency who provides you with a caregiver to assist with ADL such as bathing, grooming, or dressing, help your loved one with meal preparation, cleaning up around the house, things like that. All the things that you normally would have to do, but you can't right now because of familial obligations, work obligations, or anything else. What is a nursing home? Well, a nursing home is basically a new residence for your loved one. They are going to be moving there and living there full-time to receive care. A lot of times, nursing homes are also called continuing care facilities, assisted living facilities, or senior communal living. What are some of the key differences between home care and a nursing home? Well, first of all is comfort of care. In home care, you're staying at home. You're in your own environment, you're in your own bed, you're in your own living room, versus a nursing home, you're completely changing your residence, where you're living, your entire environment. Some people may not mind moving residences to get more care, but for some people that might be extremely uncomfortable and they just don't want to do that. Number two, sense of community. A nursing home may have a larger sense of community than you would experience with home care. There's a lot more people your age in a nursing facility. There's a larger sense of community. They have activities, things like that. Versus at home, if there's no immediate friends or family visiting, there is definitely a concern of isolation, which is detrimental to senior health. Another key comparison here is the independence and flexibility of scheduling. In home care, you're in your own element, you're in your own environment. There's a lot of flexibility and independence. You get to decide what your schedule looks like, what your day looks like. In a nursing facility, that might not necessarily be the case. You may have to schedule personal care around the shift work of a caregiver, as well as having set dining times and routines. Now, the final consideration is cost. With a nursing facility, especially continued care facilities, a lot of times there is a steep cost of entry. I know some facilities that require $200,000, $300,000, $400,000 down payment to buy into their community. Most patients end up selling their residential home and using that as a down payment to get into this community. With home care, there really isn't much of a cost of entry other than the hourly rate that you're going to be paying for the agency itself. Right now in Pennsylvania, in 2025, the monthly average costs for nursing facilities can be between $8,000 to $20,000. These are very wide ranges, and it does affect what kind of quality of care you get. Generally speaking, a more expensive home is going to give you better, more personal care, as well as larger amenities, better facilities, things like that. However, with home care, if you're looking at the top-end nursing facility, it's still going to be cheaper to hire somebody for 24/7 care and stay in your home than it would be to go to a facility. Remember, with a facility, you're paying for a lifestyle and a sense of community as well. With home care, you're residing in your own home and continuing life as you have it right now. Let's get into the pros and cons of home care and nursing homes. Let's start with home care first. The pros are you get a lot of flexibility, you get your own independence, you get to choose your schedule, you get to stay in your own home, and you get to enjoy the comforts of your own home. Cons of home care would be, number one, caregiver burnout. When you don't have a professional caregiver and you have a family member or a loved one taking care of you, are they feeling the burnout? Number two would be possible need of modifications for your home in order to stay there. So that would be things like a stair lift, ramps, grab bars in your shower. These can be costly. And finally, home care itself can be costly relative to other things. If you're looking at a cheaper nursing facility because you need increased amounts of care, the balance between how much home care you're going to get for your money versus how much nursing facility care you're going to get for your money can come pretty close. So you have to be careful. So let's get into nursing homes. What are the pros and cons? Well, the pros would be a better sense of structure and a schedule that you can follow. There's going to be times for breakfast, lunch, and dinner arranged by the dining hall. There's going to be times that you're getting personal care because of the hourly rotations of the caregivers. You're going to have a lot more of that structure. And if you like that, then that's great. You also have better access to 24/7 medical care. You're not really going to have to wait around for appointments very long. There's a team of nurses and a doctor on staff at every nursing facility for the most part, and they're going to be able to provide you care a lot faster than if you were in your own home. And finally, the sense of community. You are amongst your peers and people of your own age. If you find that you like to go to activities and meet new people and go do those kinds of things, then this might be a great fit for you. The cons. There's a lot less independence and flexibility with a nursing home. Because of that rigidity and that structure, where you do have to abide by the dining hall hours, you do have to abide by caregiver schedules, you may feel that your life is being run by somebody else and not yourself. Secondly, you might feel that you don't have a lot of personal space anymore because you're just constantly surrounded by people. At home, if you don't want guests, you just close that front door and that's that. But in a nursing facility, there may be people coming around to check on you. You might not have all the privacy that you did before. And finally, the emotional stress and potential negative effects of having to move out of your own home to a nursing facility. A lot of people find that very emotionally challenging to process and have a difficult time assimilating to that environment. So, which one's the right option for you? Well, there's a lot of things to consider about which is the right fit. Primarily, it would be around budget and care availability. Does it fit in your budget? Is home care an option for you budget-wise? Will you be able to afford increased amounts of care as well as increasing the accessibility of your home? Or is a nursing facility more of a better fit? Are you okay with longer periods of independence with scheduled care visitations and rotations in order to achieve a larger sense of community, more overall available care? A really good way to look at this is home care can be compared to private home tutoring versus a nursing facility is like a public school. At a public school, help is almost always there, but you have to raise your hand and ask for it a lot of times. Teacher's only going to come by a few times and check on you, and all your classes are scheduled, all your hours are scheduled. You go where the school is telling you. Versus like a home private tutor is going to be a lot more independent, and it's going to be one-on-one, but they're only there when they're there. So outside of that, it's on you. That leads us to our second point. What about caregiver availability? Is there a loved one or a family member or somebody who's willing to take care of you on the hours that you don't have a caregiver? Are you looking to hire a caregiver for 24/7 care if care is not available? These are all things that, again, play into budget as well as things that you should think about. If you need somebody who's there 24/7 but can't afford 24/7 care, then you should definitely consider a nursing facility. If you have somebody who's dependable and reliable to look after you, but just needs a little bit of assistance during the day to fulfill their own obligations and schedules, then home care is definitely the right fit for you, especially if you feel more comfortable at home rather than in a larger communal environment.